Mabuhay!
I am Danbert Credo.
I am Neka Nagbario.
I'm Rina Nunez,
And
and we are the Group 1. And now, we will present the first aid for common kitchen accidents. First aid for cuts. Causes, knives, broken glass, sharp cooking utensils. First aid. Stop the bleeding. Apply direct pressure to the cut with a clean cloth or bandage. If the bleeding continues after a few minutes, add more cloth layers and continue greasing. 2. Clean the cut. Rinse the wound gently under cool running water to remove dirt and debris. Use mild soap around the cut but avoid getting soap directly in the wound to reduce irritation. Do not use hydrogen peroxide or iodine on deep wounds as this can damage the tissue. 3. Protect the cut. Apply a thin layer of antibiotic ointment or to reduce the risk of infection. Covers the cut with a bandage and adhesive strip to keep dirt and bacteria out. 4. Change the bandage. Replace the bandage daily or whenever it becomes wet or dirty. For minor cuts, exposure to air after a day can help with healing, but keep it covered. It is in a place that could easily get dirty. Precautions. Keep knives sharp, wash separately, and store appropriately. Pick up broken glass with a paper towel.
Stop the burning. Remove the person from the source of burn. Example, hot object, flame, or chemical. If the burn is caused by electricity, ensure the power source is turned off before touching the person. Cool the burn. Immediately cool the burn under the cool water, not cold running water, for at least 10 to 20 minutes to reduce pain and swelling. Avoid using ice as it can cause further damage to the skin. Protect the burn. Gently pat the area dry. The cover is loosely with clean non-stick bandage or cloth to protect the skin from infection. Avoid using floppy materials that may shed fiber and stick to the burn. Precaution. Use pot holder, torn stove, oven off when done.
First aid for electric shock. Causes: burn cords on appliances, ungrounded outlets, water in contact with appliances. First aid. Number 1. Turn off the power. Immediately disconnect the power source. If possible, turn off the circuit breaker or unplug the appliance. Call emergency services. Dial emergency services like 911 immediately. Provide CPR if necessary. Treat the burns of injuries. If there are visible burns, cover them with a sterile non-adhesive band-aid. Precaution. Replace worm cords. Disconnect small appliances when not in use. Use outlet covers.
First aid for slip, trips, and falls. Common causes of slip, trips, and falls in the kitchen area are wet or greasy floor, poor lighting, cluttered walkways, uneven flooring, electrical cords on the floor, improper footwear with poor traction, and changes in floor level. First aid for slip, trips, and falls. First, make sure you're not hurry before standing up, because getting up in the wrong way could make the injury worse. If you can't get up on your own, yell for help. And lastly, if the area is swollen and you think you might have a fracture, try not to move. Call your doctor or an ambulance for an immediate treatment. Precautions of slip, trips, and falls. First, keep the floors clean. Second, wipe up spills immediately to prevent slips. Third, use a step tool to reach high places and as to prevent falling accidents.
First aid for choking causes not chewing food thoroughly, inability to talk, difficulty breathing or noisy breathing. First aid assist the situation. Determine if the person choking. Number 2. Call for help. If the person unable to breathe, call emergency. Stand behind the person and slightly to the side. Number 2. Lean the forward and support their chest with one hand. Number 3. Use the nail of your other hand to deliver up to the sperm pack close between the shoulder blades. Stand behind the person and wrap your arms around their waist. Number 2. Make a fist with one hand and place it just above the person's navel. Number 3. Grab your purse with your hand and perform quick upward thrust. Number 4. Repeat up times in the obstruction is not cleared. If the person becomes unresponsive, begin CPR. First aid for eye injuries. Causes: accidentally shoot lemon juice, toxic chemical, foreign object. First aid assist the situation. Determine the type of eye injury. It could be due to a chemical splash, a foreign object, a burn of trauma from impact. Number 2. Types of eye injuries and first aid steps. Chemical splash. Hold up affected eye. Open the flash with cool, clean water or at least 15 to 20 minutes. Use a sink, shower, or eye wash station if available. Number 2. Make sure the water flows from the unaffected eye to avoid contamination.
First aid for poisoning. Assess the situation. Identify the substance ingested, determine which cleaning agent or chemical was accidentally mixed with the food. If possible, read the label for first aid instruction specific to that chemical. Contact emergency services. Drink small sip of water or milk. Only do this if instructed by person control. Precaution. Keep out the reach of children. Use safety locks on cabinet drawers. Don't mix kitchen